Good afternoon. My name is David Olea. I am a senior at the Nogales High School, and I will be presenting oral health awareness. It's a campaign that I'm running. So I will be presenting. I'm a senior at the Nogales High School, and then dental professional is Dr. Armando Olea. If you would like to.
Well, it's a custom for the presenter to give a little bit on the background of their experience and knowledge. So I'm a dental professional. I'm a doctor in dental surgery. Graduated in 2003 from the Universidad Autónoma de Guadalajara, and I've got a residency in implantology in the Universidad Autónoma de Mexico. I've been a member of the American Dental Association since 2007. I retired from dentistry a few years back, but I still have the practicing and the knowledge to help out in this presentation.
And then what will be covered in this presentation. So it's important that we cover the importance of oral health, tooth decay and gum diseases, proper brushing techniques, flossing, and daily hygiene, and how to prevent oral health problems, as well as questions and answers. So we'll start off with the importance of oral health. So why does oral health matter? It matters so we can have teeth where we can smile, speak confidently, be confident, and speak properly, eat comfortably, no pains, no aches. It also affects your overall health. Having cavities can affect other organs within the body. Poor oral health can lead to discomforts, again, with your chewing, or you're uncomfortable with the way you look, as well as good oral health prevents expensive dental treatments. Nowadays, doctors, dentists, very expensive implants, they charge a lot.
Can you go back a little bit?
Yes.
So making a little bit extended point on the oral health can also affect overall health. And that's because the study of dentistry used to be called stomatology. So everything that you eat, consume, starts with your mouth, right? So if you don't have a good overall health in your dental, in your oral health, you're not gonna have a good diet, first of all. You're not gonna be able to chew your protein. You're gonna have discomfort when eating certain foods, and that's gonna lead to probably a bad diet, and you're gonna have deficiencies in different vitamins, minerals, in protein. So nowadays we do have a much softer diet, but a good diet is probably something you have to chew on. So if you have bad overall health, if you have bad teeth, you're not going to be ingesting properly. You're not going to be chewing your food properly, and that's going to affect your stomach, your intestine, and that leads to more complications. So that's just a little bit idea of why you need a good overall health in your mouth and your teeth.
And then to help understand what we're going through is the human anatomy of the tooth. So here we have the crown, the neck, the roots, and then this right here is the nerve. This, that looks like a sponge, that's your bone. And you have your ginger or / your gum, and then your pulp center, your dentin, and then your enamel on the outside.
Yeah. So people always ask, hey, what's it called, the brain freeze? Where does brain freeze come from? What actually comes from this nerve. This nerve detects temperature changes, and it's very sensitive to cold. So if you go below a certain degree of coldness, this is going to tell you, hey, something's wrong. Look out! You're eating something that's not good for you, and then you're going to get that brain freeze. And a lot of people ask, and it's something, trivia.
And then next we'll be discussing tooth decay and gum diseases. So what causes cavities? Oh, cavities are caused by bacteria in the mouth. And these bacteria then produce an acid which then start eating away at your teeth. So what feeds these bacteria? What foods are bad for you? And a lot of them are usually candy, soda, juice, sport drinks. Normally a lot of things with an abnormal amount of sugar, an excessive amount of sugar. Cookies, chips, crackers, white bread, sticky foods like gummies, caramel, dried fruit. All the stuff that gets stuck in between your teeth and is hard to get out will normally lead to these bacteria receiving some source of food, which then cause acids to be produced. And then these acids that are produced are slowly damaging the enamel, which is, if we go back, this outer layer, it starts damaging it, and then it starts coming into the inner layer and further in, which will cause discomforts and pain. And then cavities it's the hole, it's the cavity that's left behind. It's the hole, it's not the bacteria itself.
Yep. So the main word here is acid, right? So we need to maintain a balanced pH in your mouth, and that's done with we're going to talk about the next is the hygiene process and procedures. But the main thing is maintain that acid to a balanced level, which is probably going to be a pH of 72. Anything below that, above that, is going to be affecting your enamel. And remember, your teeth are made out of calcium and other minerals, and those minerals kind of separate when your pH is not balanced. So this is the main word we're looking for, and maintaining that acid in levels we can keep our teeth healthy.
So these are the stages that you undergo when you have cavities. Is the demineralization of the tooth. You lose the calcium, the other minerals that come within. The enamel decay, where it starts eating into your tooth. Decay reaches second layer of enamel, or the decay reaches your dentin. And, I think I skipped one. And then the fourth stage is decay of the tooth pulp, which is usually what causes the toothaches, the discomforts, the pain, and then infection and inflammation of the pulp, this is the point to where you need to get your tooth removed. And then these are the stages of tooth decay. So this is the first stage that we talked about, where it reaches the outer layer of enamel. Here it reaches your dentin, the second layer, and then here it reaches the tooth pulp, which is the deepest it can go. And then you get infection and inflammation of the tooth, which the pulp has nowhere to go when it swells. So the tooth, the dentin keeps it there, and that's what causes the pain. Because if you get bruised somewhere else, it expands, and it has somewhere to go. There's space, but not in your tooth. So that's what causes the irritating, the pain that you can't handle.
Right. So can you go back a little bit?
Okay.
So I used to do a lot of root canals, and exactly what David was saying, that this is the main producer of pain. This is something that people describe as the worst pain they've ever felt, more than having a child. So when this produces pain, there's nothing you can do to take it away, but actually injecting anesthesia directly into the nerve, so it reaches the point of pressure. Because if you come in and inject anesthesia here, where you think it's going to be taking that pain away, it doesn't work, because the pH of this is way too low. So also the anesthesia works at a certain pH level. So this is not going to work, because the infection is not permitting the anesthesia to reach the nerve. So we actually have to go drill and inject directly into the nerve to get rid of that pain. And then you lose the pain right away.
And then gum diseases, gingivitis, and periodontitis. A buildup of plaque along the gum line. So plaque usually builds up when you don't brush your teeth. It's that white gunk that you normally see when you notice that people don't brush their teeth. Some symptoms can be red or swollen gums. You'll feel usually some sort of irritation. Will bleed when you floss your teeth. And if it's not treated, you can lose your tooth because it gets to the point where it deteriorates so much that you lose that tooth because that tooth has nothing to hold on to.
True.
So here is what gum disease progression would look like. So this is a healthy gums. This is gingivitis. Inflammation out here is usually the upper layer of the gums. The thing that's easy to see, and this is the plaque. That white stuff, or sometimes yellow, that you see on the underneath of the tooth. And then this is where it starts to get worse, where it gets so bad that you get periodontitis. And there's a pocket in between the tooth. There's a gap now, and the bone starts to be destructed.
Recede.
It starts receding, and then you have advanced periodontitis, whereas you have an advanced and an extreme amount of bone loss, and then there's deep pockets, and this is where the bone loses its footing, causing it to fall out or even need it to be taken out.
Right.
And then we're gonna go over now proper brushing techniques, which usually what is recommended is to brush your teeth 3 times a day, but it's fine if you do it twice. Right? When you wake up, before you go to bed, and normally after your lunch. After lunch, it's very good to brush your teeth to help prevent a lot of these diseases. It is recommended for you to brush your teeth for at least 2 minutes, a minimum. Use fluoride toothpaste and use a soft bristle brush in order to help you reach the inner parts.
Right. So the stiffness of the toothbrush, sometimes you need something stronger, maybe medium. There used to be a hard bristle. Now it's only medium and soft, because it actually, if it's too hard, it scratches the surface of your tooth and makes it easier for bacteria to stick onto it, and you can help recede your gums if you do it too hard. So now you're gonna find soft and medium hardness on the bristles, but I would recommend probably a medium if you're young, softer one when you're a little older.
And then proper brushing techniques. Well, you need to apply toothpaste. Usually this toothpaste does have fluoride in it. You apply it, and then you brush the front of your teeth, and then you work your way to the back of the teeth, and then the top of the teeth. You gotta go work your way from front to back, from either left to right or right to left. Make sure you get the top, and then gently brush your tongue. Make sure to ensure to brush for 2 minutes, and then rinse your mouth once you're done.
Right. So for kids, I know the toothpaste has, it's good tasting. It's got flavors. It's got fruity flavors. But you gotta supervise children when they're putting on the toothpaste, because it's got fluoride, right? So it's not meant to be ingested. It's meant to be a topical treatment. So just a little bit, probably, a very small amount of toothpaste does the same work as if you fill it all up. So make sure they're not consuming that toothpaste, because it does affect your, your overall health if you do consume that excessively.
And then flossing daily hygiene. Flossing and daily hygiene. So why is it important to floss? When you floss your teeth, you're basically going in between your teeth and taking out all that gunk that would otherwise remain there, which if you don't floss, it can cause a plaque buildup, which sometimes results in tiny little stones in between your teeth. which if you don't remove can feed these bacterias, then again causing cavities. And then it also helps prevent gum disease, removes plaque between teeth, and flossing should be done once a day, probably near the end of the day, once you've already finished eating. Before you go to bed, floss your teeth, make sure to get everything out. And then flossing techniques. I do have a video, if it loads. Here you go.
Here are the 5 steps incorrectly to keep your mouth healthy. First, wind about 18 floss around your middle fingers. Pinch the floss between your thumb and index fingers, leaving an inch or 2. Now gently glide the floss between your teeth. Glide it around your tooth, making the shape of the letter C. Be sure to unroll the floss to a clean section as you go.
Right, so that would be proper flossing techniques. Going in between the teeth, making a letter C, and ensuring to get everything out.
Right. So if you go back just to the front. Okay, so it's gone. Anyway, so you wrap it around the middle finger, right? So when you were gonna do your top teeth, you kind of use your thumbs to work that in there. Okay, so like David said, you always work towards the sides, never up and down, because you're gonna end up hurting your gums, and that's gonna help recede your gums. Not in a good way. It's gonna make your gums recede. We don't want that. We just want to clean the tooth. So you go sideways as far as you can without hurting yourself. If there's bleeding, it's fine. As long as it's not excessive. If once you start doing the bottom ones, you wrap it around the middle finger, and you start using your index to work your lower teeth. So that's pretty much it. If you have any motor difficulties in your hand, it's better if you use the ones that already have floss already to a size, and you just use it as a toothpick, and it's got the floss on one side and toothpick on the other. That's a good one if you're having hard time to using your fingers to work around your teeth. Also, a good thing is if you want to use the water pick, it's a very good tool, especially if you have any motor difficulties, or you have fixed bridges, crowns. That's going to help clean under those hard to reach edges.
And then how to prevent oral health problems. So the main point is to help prevent issues and help prevent you having to spend more with a dentist, more than you have to, right? So foods that affect your teeth. Again, sticky foods like caramel, gummies, dried fruit stay on teeth longer. It's important to be careful with the food you consume, because a lot of it does get stuck in between your teeth if you're not careful. Acidic foods and drinks can wear down enamel, which will negatively affect you. It makes you more probable into getting bacteria, which can cause further issues. Sodas, sport drinks, and energy drinks are especially harmful with all the sugar they have in them. Chips, crackers, white bread break down into sugars, and these sugars, again, affect your teeth. So how to prevent dental problems? Make sure to brush your teeth 3 times a day, floss daily, limit your sugar, drink water, and visit a dentist twice a year. Now, it's recommended that you visit a dentist every 6 months for professional cleanings, because when you brush your teeth, you can only get so much. When you floss your teeth, sometimes it's important to go to a professional who can get those hard to reach spots that you normally can't get, especially if you have dentures or implants that you have to remove and clean underneath the implants, and your complete implants of the entire top row, or the ones that screw on and off. And then we have dental kits to give out. And then questions and answers. If you guys have any questions, please feel free to answer, or we'll answer. Feel free to ask your questions. Yes.
So if they already drilled your teeth, can you still get cavities like where they filled it? See?
Yes, so yeah, you definitely can get cavities. If there's any part of your tooth left, it can get decayed. So even you know, if it's got a little filling, if it's got a inlay, onlay, I mean, we're going bigger. If it's got a crown, even if it's completely crowned, you can still get cavity under it. So that's what I was saying. Try to use the water pick. If you do have a crown, that water pick is going to clean around that crown into those hard to reach areas, and that's going to keep the buildup from providing any decaying your tooth. So yeah, definitely, if you still have any part of your tooth left, real tooth, it's going to get decayed. The only one that don't get decayed is implants, because they're titanium, but you can lose the bone around it, and you can still lose that titanium screw in your gums, and we're back to zero.
I have a question.
Yes.
What about, my question is in regards to floss.
Okay.
Does it really matter what kind of floss? Because there's different types of flosses. I've noticed that the older I get, there's the floss that's really thin, which I love,
Yes.
or there's thicker one. Is there does it matter?
Yes.
It's just pulling out
No. So it depends on the space you have between your teeth.
Mm-hmm.
I'm gonna say someone that's got very little space, it's really tight, then you can use the thinnest one.
Mm-hmm.
Because that's gonna get in there without pushing or pulling, or sometimes it gets stuck, and you can't use the ones that are in the tooth, because it's gonna get stuck and you can't pull it out. So you're gonna need to use the one you wrap around your finger and just pull it or slide it out one way, right?
Mm-hmm.
So if you got larger areas, you can use the thicker ones. I personally like the ones that are like braided. They're like braided. If you kind of push it towards, if you grab it on each side and you push it towards the middle, it's gonna open, and that's gonna cover more surface and clean better.
Oh, really?
Those are the braided ones. Those are really good. You pull it, it becomes really thin. You push it, it's a little bit braided. The ones I don't like are the ones that are complete rubber. They're like just like a strip.
Mm-hmm.
They don't really work. They were really popular at one time. They're like a strip. You do it sideways. They cut. They hurt your gums. They cut into your gums. They don't really clean a lot. But I think they're going out of the market. But they were really popular at one time. So it all depends on you. If you've got really small spaces, use the thinner one. You can use the larger ones when you have bigger spaces. If you have like fixed dentures or fixed bridges, you're gonna need an even thicker one, which has got like a little hard point on one side. You push it in from one side, and you kind of work your way through the bridge, and that's even thicker. So it all depends on each person, but yeah, there's different ones. One for each case.
Thank you. Thank you for explaining that.
So when you get a cavity filled, the stuff that they put in and then they harden it, does that kill the bacteria that's already in the tooth?
Oh, okay. So that's a good question. So no, the filling itself doesn't kill any bacteria in there. You actually have to clean it with a drill. You take the largest part of the bacteria and the decay with the drill, and then you actually have to disinfect it. You put a disinfectant in there to clean it out, and then you put a little base that's made out of I forgot the name of it, oxy something. That is actually a antibacterial. You leave it out as a base under the filling, and then you fill it up. So that's an old technique Now you kind of use the resin, which is the same color as your tooth. That's more popular. It's the same thing. You disinfect it, but there's no base because since it's plastic and the base is more flexible, when you chew on it, you kind of break it. So now it's just a little thin layer of antiseptic. Sometimes they put some sealant or primer, and then they put on the resin, which is the same color as your tooth. It all depends on how big the cavity is and how much repair it needs. You know, you use different materials, you use different techniques, but basically no, the material doesn't kill the bacteria, but the treatment we put under it does. That's why you use the rubber, there's like a rubber, it's called a rubber dam. So you make a little hole in the middle, and then you separate everything, like the rest of your mouth from where you're working at, so your saliva doesn't go back in there and contaminate it. That's why they use that. I don't know if you've ever seen it. It's a blue, green, yellow rubber dam you put around the tooth they're working on.
How often should we replace our toothbrush?
Okay, so that's a good question too. Your toothbrush, the more you replace it, the better. They make it more disposable every time. So if you start seeing the bristles open up a little bit, or if each bristle starts to open, it's time to replace it. I personally don't recommend the ones that have the rubber bristles or I don't know how else to explain it. They got thicker rubber parts in either inside or the middle. Those don't do a very good job in cleaning. So I recommend the normal bristles and medium. And once you start seeing them open up, move, or deform, replace it. If you do it, every so often, the better. It's good to let it sit in a little bit of mouthwash as well, so you can disinfect it, rinse it out, and then put it away. So that's another question. How do I clean my brush? Just running water, get everything out of it, and disinfect it, either Listerine, whatever you want, and then you can put it away.
And what about electric?
So electric brushes are really good alternative if you can't really do the movements, okay? So let's say someone that's got arthritis, Parkinson's, something that's hard for them to control the movements, it's a very good idea to recommend or use electric toothbrushes. Most of them do the circular motion, either go back, some just go one way, others kind of go like back and forth. Those are the better ones, and use that, and at the same time as you use the water pick.
And what about mouthwash?
So mouthwash is a very good tool to keep your pH balanced. Okay, like we were talking about, it doesn't do much cleaning. What it does, it helps disinfect and keep your pH balanced. It's not a good idea to use it too often as well. It can, it's an antiseptic, so it doesn't just kill the good bacteria. The bad bacteria kills good bacteria. The good bacteria, thanks to nature, it replenishes itself pretty quickly. But if you keep doing it all day long, or very frequently, or for long periods, you're going to feel that burn, and that burn is not just killing the bad bacteria, it's killing the good bacteria. So, just maybe once or twice a day, just to keep your pH balanced before you go to bed, it's probably the best. Don't overdo it.
And I think I have one last question. So there's so many options out there. You see teeth whitening.
Yes.
Toothpaste. Fluoride free.
Yes.
What about all those things?
Yes. So toothpastes, they're like overrated. There's way too many. They do a lot of stuff. They do a lot of miracles. But the a good toothpaste and a good brushing technique should be enough. The toothpaste is just not added on, something that's just making it a little bit better. But the tooth technique is the one that's actually getting your teeth clean. So if you use the ones that have extra fluoride, you don't really need it. Right now, if you got extra fluoride in your diet or in your toothbrush, it's not going to do a lot of good in your teeth. That's good when you're developing and you're getting new teeth in, and then that's when the fluoride does its work, right? It helps to protect it while you're developing your teeth and make them a little bit stronger. But later on, it's not that necessary. Besides, you get it in you get it in different forms. You don't really need to add it on to your toothbrush like extra fluoride. Whatever it's coming in is fine. If you want to use a whitening one, it's not going to whiten a lot. It might help a little bit. It depends on the stains you have. If they're superficial stains, it might help. The strips might help a little bit if they're deeper stains. So the tooth itself, the enamel, has got a bunch of little tubes. Okay, so all those little tubes are the ones that are getting all that stain in there. So like I'm gonna say someone that drinks a lot of red wine, those tubes are gonna fill up pretty deep. So you're gonna need something more professional to clean those, to whiten those teeth. But if you keep consuming those products, it's gonna just come back. So it's whitening is just something. If you want to look, your teeth look brighter, it's fine, but it's not gonna say too healthy. If you do get whitening, it's good to have fluoride treatments afterwards, because that fluoride is going to go into those little tubules and fill it back in. It's going to make it harder for the stain to go back in. Okay, but it all depends on what you're looking for, and they're not really that necessary.
Any further questions?
Anything about implants, dentures, crowns, complete
So when
implants?
when you replace a teeth with a crown, correct?
Yes.
How it lasts forever, or
Yeah, so the crown itself is going to last forever. Depends if you take care of it. If you do a good job taking care of it, it should stay there forever. What you're going to be losing is the bone itself, or sometimes like the cavity can creep under the crown, and then you're going to end up either getting other tooth treatments or losing that tooth. If you do lose a tooth, it's fine. Now there's a lot of techniques to actually get that bone back into place and screw an implant in there and get another crown. So now the technology is really advanced. You can get implants and start, wearing a crown weeks afterwards. Before you had to wait 3, 4, 5, 6 months before you get a crown on top of your implant. Now it's pretty quick, painless, and you just go in there. It depends if you have enough bone. You go in there, good healthy bone. You just work the implant in there, and a few weeks later you get the crown. If you don't have enough bone to hold that implant in there, then we have to implant some bone, some tissue in there, and then work on the implant. But advances, bones are actually very advanced right now. They're made out of different types of calcium and minerals. They used to be cow bone, and before that they used to take out bone from different places and then implant it on yourself. Now it's something that's made in a lab, and your body doesn't reject it. It's pretty quick and a painless process.
Okay.
All right. If you don't have any more questions, we're always available. And
Are you a dentist?
yes.
Oh, okay. Alright.
Yes.
And you're gonna be a dentist too?
Hopefully, yes.
Okay. Alright.
Yes. I'm a dentist since 2003, and I've got a residency, which is a short, specialty in implants.
Mm,
And so, yeah,
all right. Thank you.
welcome.
Thank you.
All right.
Thank
Thank
you.
you.
You're not paying picture. You need this.